Okay, seems like you're back.
Yeah, can you come
Can you
again?
hear me? Okay. I said before we start, let us start with the story about myself. So, I went to a school of nursing actually, and the program is for 3 years. I hope you can hear me. Everybody should excuse me. I'm coming from somewhere. I'm very sorry. So, the program is for 3 years, and after your third year, you write a qualifying exam to become registered nurse. I wrote the exam with my classmates. We're 15 in the class. So I wrote the exam with my classmates. Unfortunately, I did not pass the paper. So meaning I have to come back for 6 months and write the exam. That was like a major setback for me. Like, I actually did not know how to go about it. I cried myself every night. Okay, how do I want to do this? Where do I start from? Where do I read from and all? So I went back to school for the 6 months to write my exam. But within that 6 months, I attempted suicide. Like,
Wow.
I had the thought, actually did it, but it failed. All thanks to God. So after the whole suicide attention and all, so I sat down and I was like, is this how I want to run my life? I think I have great plans for myself, so why do I want to ruin it now? Then I sat down, took my book, read all over again, wrote the exam, passed. And fortunately for me, that same month that I passed my qualifying exam, I also gained admission to do my psychiatric nursing, something I've always wanted all my life. So now, let's leave my story and move to the main topic. Depression is a persistent change in feeling and emotion, feeling of sadness, feeling of loneliness, feeling of tiredness, you not taking pleasures in things that interest you anymore. And when depression doesn't start, it's not a sudden occurrence. It's very gradual. Like, you don't just move into depression, or I'm trying my best to use layman language. I'm sorry.
Yes,
I want
yes,
to start
please.
using some things. Try my best to use layman language. So you don't just fall into depression. It is a gradual process, like a very gradual process. And when you are depressed, it alters everything about you. Your work schedule, it alters your physical appearance, it alters everything about it. Because normally you would wake up in the morning, would love to have your bath and freshen up and all. But when you are depressed, I'm sorry, you won't even want to do any of those. You just prefer to sit and watch and just be thinking. And there are various or different types of depression. There is anxious, there is depression caused by trauma. I think that's the type when either you lost a loved one, or you lost a job, lost an opportunity, failed an exam, had an experience that tampered with your brain, or let me say that you felt like, no, this is not supposed to happen. Trauma, depression caused by trauma is the most common form, because it is something that triggers that behavior, you sitting alone. And there are different signs you will see when someone is depressed. They sit alone, they prefer to be all by themselves, they don't want to talk to anyone, things that they take pleasure in. Some people take pleasure in watching movies, going through the net, but no, they just want to be and not involved in anything at all. And there are sometimes depression comes with psychotic features, where the person exhibits all that psychiatric symptoms. Don't let us go into that. There's also peripartum or postpartum depression, where peripartum is during pregnancy or before pregnancy. It happens. They don't feel affection towards the child. They just look at that child and be like, who is this? What's this doing in my life? I know. Do you understand? Also, we have catatonic depression. We have different types of depression. We have, and also depression. There's depression in children and teens. There's depression in children. Yes, there is. When you notice a child that is an extrovert is someone that loves to play, someone that loves to mingle, someone that likes to socialize with everyone, and you suddenly see that child just withdrawn to self, or child sees a particular person and be like, when the child might be playing, and when the child sees that person or an object and the child just withdraws, and you be like, oh, what's wrong? What's going on? You have to question that child and be like, okay, what is wrong with you? I noticed this. The child will just be withdrawn. The child will not play. Some will not even eat. Some will not eat. Some will not sleep. They'll just be staring into the blank space and just be looking. And all. So you can notice depression in any age group, a child, teen, adult. And there are different ways to battle, or let me say, first you sit and be like, okay, do I want this to break me or make me? That is the first step to finding solution to any problem you have. Okay, do I really want this to break me or make me? Do I want this to be the end of me? And let me tell you, any person that is depressed will definitely have suicidal thoughts, suicidal ideation. Some will attempt, like I did. Some it might be successful, and some it might not. So the thought will just come and be like, okay, what am I even doing? I should just end everything. And no. The best thing is talk to someone you trust, someone you can confide in. Can be a family member, can be a friend, can be anyone in your faith gathering, either in church or in mosque or any faith group that you are. Can be anyone you talk to, someone you can trust and say, okay. When I tell this person, okay, then while you're at that, you can also see a therapist. In Nigeria, we have this idea of when you walk in to see a therapist, you are not fine. It is really, really wrong. It is a very wrong mentality. You should be able to walk into a therapist office, either a psychologist or a counselor or anyone, and discuss whatever it is you are going through. See, no one is perfect. No one has everything. You don't have everything set with you. We all go through crises and all, and it is fine not to be okay. It is very, very fine not to be okay. You don't have to be okay all the time. When you are not okay, you are not okay. Speak out. Talk to people. Let them know what is wrong with you. Don't keep it in. The more you keep it in, the more harm you are doing to yourself. Say it. Tell someone. Some will not want to come and talk to you face to face. They will prefer to call you on phone. No problem. Just say it. When you let it out, you will feel a kind of relief, a sense of peace. You'll be like, okay, I think this is nice. So it is fine not to be okay. Walk into a therapist's office, explain what is wrong with you. If you will be placed on medications, fine. If not, there's something we call psychotherapy. Psychotherapy is just you seeing a professional and you just talk. You just talk. Psychotherapy is talk therapy. You just talk about everything you are feeling, how you are feeling, okay, what you feel like doing, and all. So there are different ways to treat depression, like I said earlier. So I've talked about psychotherapy. We have medications. Don't let us go into medications. We have SSRI. We have our minds, different medications.
Don't worry about that one.
Medication.
Yeah.
So when you see your psychiatrist, they will definitely tell you which one is good for you to.
So what
whatever it is you are going.
That depression can be cured medically, like
It
There are drops.
it can
to it.
it can be maintained. Let me say it can be maintained, not cured. It can be
So
maintained.
I'm depressed. Assuming I'm depressed now, I can just walk into an hospital or something. What?
Yeah, let's say a psychiatric hospital. Not hospital. See, not hospital per se. We have clinics that offer counseling session.
Exactly. Okay.
You don't
Okay.
necessarily have to go to a psychiatric setting. We have clinics that offer counseling session, and those that are there to handle it as psychiatrists are professionals, not just a random person. It's someone that when you talk, the person understand what you are saying. Not someone that you just talk and the person will like and they will have to refer you, because this referral thing also hinders people from taking or from seeking help, because when they go to a clinic, maybe a general setting, and they have to refer them to a psychiatrist, they'll be like, no, I'm not going. So it's better you check, okay, where I'm going, they have a counselor. Okay, is the counselor qualified enough to attend to me, to attend to my needs? Then you go. But once they refer them that, okay, go to a psychiatrist, so they'll be like, no, I'm no psychiatrist. What do you want people to say? So that is just
They will think I'm mad.
Yes, they'll think I'm mad. So what do you want people to say? How do you want people to look at me?
Okay. Can I ask a question?
So any question?
Or you are not doing it?
No,
Let me know if you
any
are done
question?
so that I can. I have questions.
Okay.
I don't know. I can't see people's comment. Maybe if they are commenting, I don't know. I can't see it. But maybe I can read it later or something. Now,
okay, no problem.
the question I want to ask is that one of the symptoms, I think you mentioned it, that's change in behavior, right?
Yes.
Behavioral
changes.
Behavioral changes. Now, is it similar to mood swing? Like you're having mood swing. Is it similar to that?
Mood swing is different.
But mood swing is also behavioral change. Like your behavior just changed to normal.
When you have mood swing, when you see something that you take pleasure in doing, probably music, you are described by listening to music, and music gives you life. When you have mood swing and you are down and you listen to music, you come out of it. That's mood swing.
Okay.
But when you being depressed, in fact, the music will be playing and you would not even hear anything. It won't have any meaning to you. So that's two different things.
Okay. Another question is, can feeling inferior or someone making you feel inferior lead to depression?
Yes.
Do you understand depression?
Having low self-esteem. Yes, having low self-esteem.
Yes, low self-esteem. Can it lead to depression?
Yeah. Yes, it can. Because you do not believe in yourself. Having low self-esteem can lead to depression. See, there are people with, everyone has different personality traits and personality makeup. There are some people that you talk them down and it does not have any effect on them. And there are some people that you just say a bad word at them, and like all their whole world is crumbling. Do you understand what I'm trying to say? There are some set of people that when you talk bad at them,
like someone like me.
Those words in what you say. Even if they are saying bad, they will see the good and pick out that good and just be with it. Why? There are some people that when you talk bad at them, you talk their words, you ended everything for them. That word will just keep ringing in their head. Okay, someone said this, and they start thinking over and over and over again till they hit the rock bottom. So that's just it. It can. No self-esteem.
I think so. That one is kind of kind of talking to me, because personally I don't like it when someone talk down on me. It really goes down inside me. So I can capitalize on those words. I will keep thinking on them.
Yeah.
But what really helped me is that I always try to neutralize those negative things in my mind. I neutralize them. I try to settle it in my mind. So those are things that really help me. I'm the kind of person that words goes deep inside me. So if you want, as much as I like people to correct me, I also don't like it when they talk down on me. They make me feel inferior. Talking about doing not doing what you love to do. Someone like I was talking to one teenager recently. She said when she's depressed, I just want to hear what she has to say about depression. She said someone like her now, when she's depressed, she will eat like no man's business. She doesn't used to eat normally. She will eat, like she will keep eating when she's depressed. Is that normal? Is that symptoms or what?
That's part of complications of, okay, let's say symptoms, because the complications will be adding weight, which will lead to obesity. Sometimes depression comes with eating disorder. Some will eat and not eat. Eat like that is the end of their life, and some will not even bother to eat at all. Nothing will interest them. So different people with different ways in which they cope with whatever life eats them with.
Okay.
So eating too much will be obesity. So that's complications. Those are part of complications of depression.
Okay, I think I have two more questions.
Okay, no problem.
Now, talking about some of the causes of depression, can it be hereditary? Like
yes,
in their family, that's how they used to do. It can be hereditary. Wow.
Yes, it can. It can. Yeah.
So that hereditary one, what's the cure? Like, does it have cure?
You just have to be careful. We call something risk factors. These are things that can triggers you into a particular disease condition. They are risk factors. So you have to be careful and cautioned about those risk factors. You watch out that, okay, probably you are the type that words get at you. You try as much as possible to work on yourself and be like, okay, I won't let people get at me. I'll try and see the good part of whatever anybody's saying to me. Because once you allow those words to get at you, you might start exhibiting signs and be like, oh, this person said this. Oh. And you don't know. See, people don't know they fall into depression because it is something gradual. You just start thinking, you start overthinking, and you start losing it. To you, it's just like you are living your normal lifestyle. But other people will be the one to notice and be like, this person has changed. This person does not talk like before. And they will ask you, what's wrong? Be like, nothing. But you're already slipping into depression.
People don't know they fall into depression.
They don't know. Most people don't know. They'll tell you, I'm just. It's those that can stand for themselves and be like, okay, okay, this problem, this is the solution to it. Okay, let's do this. They are the one that can bring themselves. But those that allow the problem to weigh them down, they just keep thinking in it.
I think, okay. Now, my next question is that, what is something like, you now recognize that you are depressed. What can you prescribe, like something like a first aid for you to get help? You are depressed. So something like you can do fast.
Just talk to someone you trust. Can be a family member, friend. Just talk to someone. You really need to talk to someone. You have to let everything out. Without saying it, you are not going anywhere. That's just one thing about it.
You have to just say it out.
You have to say it out. Everything that is bothering you, even if you have to cry it. Just cry it out. Talk to someone. Okay, this is what I'm going through. Even after saying everything, you would just feel relieved without any medication. You just become and be like, wow. So just talk to someone you trust. Someone you trust. Not just anybody, someone you trust.
Okay. I think I don't have any question again. Do you have a word of conclusion for us?
Yes, I have a word of conclusion actually. There is this quote or saying that I used to tell myself that for me to have come this far, I can still go further. Whenever I'm passing through a very tight phase or I'm passing through some problem, I'll be like, okay, for me to have come this far, I can still go further. And I am the type that believe that you just have to have fun. Not every time work, because sometimes stress adds to.
Okay, Claire, can you suggest some fun activities that we can use? Some of us that we don't.
I cannot.
It's not a fun. You know, there are times that, of course, fun is good, but you don't even know how to have fun. So
let me say, there are some people that when they read a novel, they are catching fun. Like they enjoy it so much that it gives them peace and happiness. And there are some people that they just have to go out. They just have to socialize with people for them to catch the fun that they want. So fun is not one thing. Fun is particular to each of us. It is to everybody. What I see and I catch fun in might look so natural to you, and you'll be like, what's so fun in this? What do you enjoy in doing this? To me, that is what gives me joy. That is what makes me happy. So just do whatever that gives you peace, whatever that gives you joy, and always make sure that your happiness comes first. When you want to make decisions, okay?
That's the key. Your happiness.
Sacrifice when. Be very sure that okay, my happiness comes first, because mind you, if you are not happy and you are making someone else happy, you never even like yourself. And everybody will be like, that person is a very good person. She did this, he did this. But you yourself, you are not happy with everything that is going on with you. So in everything you do, your happiness comes first, and always try to have fun. Those little stuff matters. Those little things you take pleasures in matter. So always try as much as possible to have fun.
You know, before I did this second video, because this is the second video, I was sharing about my own personal experience about depression. You know, I also thought of, I also had a suicidal thought, you know.
Yeah.
But thank God, though I didn't see anyone, I didn't talk to anyone. But there was someone that noticed it. someone noticed it. Said, Bro Kenny, you used to laugh before. You used to smile. I didn't see you smile. What's going on? Said nothing. No, there's something going on. That time, I'd overcome it before. That was suicidal thoughts. But the person noticed that I wasn't myself. The way I used to smile. I'm the kind of person that if you see me normally, I smile. So that's my own personality. So the person asked me, I was able to, explain, to talk better to the person, and that was the end. It's really a sad experience. I don't want to have it again. So, like you said, people don't know
really
they are depressed. That is very important key. People don't know they are depressed.
I became a shadow of myself. I hardly talk to people. And funniest part is I keep smiling. But I don't involve when it comes to playing and all. But and they ask, "That's why what is wrong?" I'll just smile. I'm fine.
Well, but that having fun, I love that.
You don't know that.
I love the aspect of having fun. Yeah, it's really good. All right. Thank you so much. For
welcome,
honoring my request. Thank you so much. I don't know how to appreciate you. Thank you, Nurse Fabunmi Adeola.
Thank you.
Nurse Fabunmi Adeola. In case anybody wants to know her name is Nurse Fabunmi Adeola Imole Oluwa. Did I get it right? Okay. Nurse Fabunmi Adeola. Thank you so much. Okay.
You're welcome.
Thank you so much. If I call you next time, I hope you answer us.
Definitely.
Yeah. Thank you so much. All right, I will release it now. I'll see you later. All right, guys. Thank you so much. As our guest, Nurse Fabunmi Adeola, a psychiatrist nurse. Before I leave, I want to just give my own last, like a conclusion for this talk. So our guest has gone. If you're just joining us, this is Soul Food Embassy. Today we just talk about depression, and we had a nurse, a psychiatrist nurse, an health practitioner who just enlightened us on what depression is, the symptoms, the cure. There are some symptoms there are some cases that you need to treat medically. There are some cases that you need to treat through counseling session or any other means. But the most important thing is, once you notice that you are depressed, talk to someone. Maybe you notice what you used to do, you don't do it anymore. Nothing appeals to you anymore. Your behavior excessive. You're having change in behavior. Constant sadness. You're feeling inferior and all that. You might be having depression. You might be depressed rather. So my last word for you today is that the most important thing in life if you want to say no to depression, is to be happy. It's to what? To be happy. Do what makes you happy. Go with anybody that makes you happy. Very, very important. Don't suffer in silence. You are suffering. There is one Yoruba that says, you don't put the hand that is paining you. You are having ailment in the hand. You don't put it under the clothes. Put it out. Let physician, someone that can help you, see it. What this means is that when you're feeling depressed, you're depressed. But the tragedy is that people don't always know they are depressed. You are depressed, talk to someone, trusted someone. There are people that you'll be surprised. Many of us, many people around you, they've had similar experience, and they will be ready to help. There are several cases of depression, and the end result most of the time is what? Suicide. Okay. In case you're watching now or later, I want you to give this video thumbs up. Comment. You can drop your question. I will answer it. And make sure you like and share, please. I'll see you next week. I have another guest next week, and the topic will be communicated with us because of the week. All right. I remain Kenny. See you next week.